Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Niru Prasad, with my background in pediatrics, emergency medicine, and urgent care. The theme of our health talk today is integrative medicine. Integrative medicine. Joining us today as my guest speaker is Dr. Keshav Grover, and he's going to highlight our viewers about the importance of integrative medicine, holistic medicine, mind and body, and more. So, good morning, Keshav, and welcome to my show.
Thank you so much, Dr. Prasad. Thank you for having me.
I know, and you were here before, and your talk was very well appreciated by our viewers. We had a good input from them. But today, first of all, before we start, can you just give your introduction one more time?
Sure. So I'm Keshav Grover. I'm a fully licensed osteopathic physician here in Michigan. Our practice is Grover Health and Wellness on Maple and Telegraph in Bloomfield Hills. And people can find us at groverhealth.com. We practice integrative and functional medicine, as well as aesthetics, helping people to look the way they want as well in our practice. And that's our passion, to help people to look the way they want and feel the way they want.
Yeah, well, that's very good, because I read a lot about this field of medicine, I wasn't aware before. But I can see the importance of this medicine because they combine it with regular medical issues. Mm-hmm. And then you try to find out what is the overall cause, what is causing this problem, not just treating the person with the medication. That's very important, like homeopathic medicine and those things like back at home. So now, reading through that whole thing, I got very much interested about the food part and also the microbiome. Mm-hmm. And I was wondering if you can highlight our viewers about that.
Absolutely. And so I think if you take a look at, as a whole, integrative medicine, what is integrative medicine? Integrative medicine is basically looking at using conventional medicine, the best of conventional medicine, because there are certain things I think I mentioned this on our talk last time. If one of us had a heart attack or some kind of acute issue, conventional medicine is the winner there. And then using evidence-based holistic practices from Ayurveda, from traditional Chinese medicine, Reiki, yoga, certain herbal supplements, and putting that together in a plan that's appropriate for the patient based upon their goals, belief systems, and what they're willing to do or try. And that's the beauty of integrative medicine. And it really allows us to create a plate, no pun intended, a plate that's palatable for the patient in their treatment goals and their plan overall.
Right, yeah.
And that's what we focus on in our practice.
This is what you focus at. Make a plan for them, everything, combination of holistic, homeopath, and everything. And that goes along with their medicine part, right? Am I right?
Absolutely. So, for example, if somebody comes in to us and they're working with their primary care, which we always encourage people to do, because primary care doctors are very good at making sure, like a woman has her mammogram or pap smear, or making sure that individuals are getting their colonoscopies done. Things of that sort that can be very life-saving, and then also managing certain medications. Now, the reason why we don't take the role of the primary care doctor is because we want to actually reduce the number of medications that patients are on, or at least reduce the dosages, working with their primary care to do that overall, number one. Number two, if patients do need certain things like antibiotics or biologics for autoimmune conditions or things like that, we're going to include that in the plan, and we're going to work with our partners to make sure that we're giving our patients all of the options that are appropriate for them.
Yeah. So basically, you are combining everything, integrating it to the person as a whole,
100%.
Which is 100%, which is very good, No, back at home, I was raised in third world country. There was a lot of things about the homeopathic medicine there and all that while I was growing in medical school. So, eastern part of the world, also in China and all those. So can you comment on those, how the whole thing had started there and it came to
Sure.
us?
So if you look at it in traditional Chinese medicine, there's a concept of the qi or energy. And if you look in Ayurveda, there's a concept of prana, which is the breath or more of like the spirit that enters our body.
Meditation.
Exactly. And even in this country, if you look at Native Americans, that they also believe in spirits and how does that affect our bodies and our health. So universally, there is this common thread that we have this energy in our system that has to flow in a particular way, just like our breath flows in and out, allowing us to breathe and oxygenate our cells. And so there's a universal acceptance of that truth, number one. Number two, from whichever school of thought you're coming from. Then the second part is that in Ayurveda and in traditional Chinese medicine, there's always this concept of gut health, making sure the digestion is optimized, because a lot of our health maladies that we can have, whether it's hypertension, diabetes, brain fog, Alzheimer's, and a lot of the other conditions we're seeing, those and some cancers, those can stem from dysfunctions in digestion and affecting our microbiome as well.
Yeah.
And we can talk about that more.
Yeah. So basically what we are talking about is, the homeopathic part of the medicine, holistic, everything like meditation and all, it helps to put your thoughts together, but the primary focus is stomach. How you take your food and how are the microbiomes in your intestine, work. And there so much work has been going on about the management of ulcerative colitis, idiopathic bowel syndrome. And the basic culprit is those microbiomes.
Yeah.
You agree with me, right?
Yeah, and I think that's definitely part of the case. And when patients come to us with the symptoms of gut dysfunction, those usually include things like acid reflux, heartburn, bloating, constipation, where somebody might not have a bowel movement for 3 to 5 days or something.
Yes.
And that can cause massive issues.
Oh, exactly.
Or they may have, recurrent diarrhea. And so those are diverticulitis and things like that. But, we're looking at their symptoms that they're presenting with.
Right.
Not necessarily, and sometimes they're coming in with a diagnosis that I do have diverticulitis, I do have ulcerative colitis, based upon a colonoscopy that was done or other testing that was done. And our job is to say, okay, how do we heal the gut? How do we balance the microbiome? And how do we also reduce inflammation that's going on as well? And to kind of patch up any leaks in the gut, because leaky gut is also another concept that has become more accepted from an evidence-based perspective, that leaky gut is actually a big reason why we have systemic disease that stems from the gut overall too.
Yeah, so basically what it is, the microbiome, leaking gut. And also I had a guest speaker who talked about the management of heart attack, coronary artery disease, just by emphasizing on the microbiome, the good food, how it stops that. So it's an upcoming field, isn't it?
Yeah, and I think we're only learning more as we analyze more stool samples and understand the billions and trillions of species that exist in our gut. And to understand, to say, okay, which ones are playing a role in our well-being and which ones are playing a role in our illness, and how do we boost the ones that are promoting well-being and reduce the ones that are creating illness. It's almost like a neighborhood. You want in your neighborhood to have well-meaning citizens that are contributing positively to your society, and not citizens that are there to wreak havoc. So that's the way I look at the microbiome.
Yeah.
And also for our listeners, the microbiome exists everywhere in our body.
Everywhere.
It's on our skin, it's in our mouths, it's in our
all the
eyes.
mucosa, all the mucosal
correct.
eyes.
Even
Mouth.
for women in the vaginal canal, and even in the whole digestive tract as well. So it's everywhere. So it's something that we really have to be conscious of in our evaluation.
Yeah, so that is very interesting to know about the microbiomes, and then, people like coming from third world countries, they have a chronic amoebic dysentery, and they have all those sort of parasitic disease. So that is another cause, isn't it?
Yeah, and I think that's another concept
You
that
try to find out what exactly is the.
And when we do our stool testing on our patients, we're able to, the stool tests that we use, not only do a microscopic analysis of the stool, but it also does a PCR analysis, which basically looks to see is there DNA of parasites present
PCR,
too.
yeah.
And so the genetic material of the parasite to see if it's there or not. Now, one thing that's been there when you mentioned parasites is that there's a lot of social media trends about parasite cleanses. And I think a lot of times patients can become fearful that they have a parasite, and then they go down all these roads of parasite cleanses when really that might not be the case. So that's why it's important to see someone like myself that can actually do the testing and to figure out is there a parasite or not before going down that road. Yeah.
So just so that I know, that I am seeing the patient as a primary care physician. I know what the problem is, has ulcerative colitis or even chronic bronchitis and those. So then I refer it to your place. What do our patient, what do they expect when they go to you, your office?
Sure.
Yeah.
So when individuals come to our office, they will sit with us for about 60 to 90 minutes. Is our consultation time.
Yeah,
that's our intake.
Okay.
And that's even before a 15 to 30-minute discovery call. So our first step is that we do a discovery call with our patients, and that's usually a video call, so that we can see, are we a good fit, first of all. Okay. And it's almost like a relationship. It's
it's build up a relationship.
Exactly. It's like that first date, right? Where we want to see, are we going to work well together?
Sure.
And am I the right practitioner for the patient, number one. Then they come in, and then we have the hour and a half conversation with each other, and I get to know the patient even better. I want to know everything about that person that I can in that time period. Yeah. I want to know, how does their stool smell like? I want to know how many times are they brushing their teeth. I want to know, does their stool sink or float? And a lot of these things that sometimes their primary care doctor, while they want to ask these questions, they just don't have the time.
Right, they don't have, because the time is limited between each. When I'm in the office, like you spend half an hour each patient, we don't have that much time to go through.
And then the other part of it is that we have all our patients meet with our dietitian as well separately on top of that. So they're almost getting 2.5 hours of intake time with our practice to really get to know them. Are they, let's say, a busy working mom? Are they an executive? Are they someone who's traveling every week, Monday through Friday?
That is also very important.
Exactly. So we want to know what your schedule looks like, so that when we do create that plan, we can input those aspects of the plan into your life. And it has to be about your plan. Right. So if Dr. Prasad comes to see me in my office for something, it has to be the Dr. Prasad plan, not the Dr. Grover plan.
Right.
If that makes sense.
So that is true. That is very good to know all this. And then when I'm very much interested about the electron microscopy, what you do with the stool examination, the PCR. So can you detect a lot of pathology?
We rely upon a few different companies that send our patients kits that they collect the stool at home. and then they send it out via FedEx or UPS to the labs.
Yeah.
One of the companies that we use, for example, is Genova Diagnostics.
Yeah, I have heard about that. Yeah.
And it's a quite robust lab in the sense that it gives us information about their digestion, their metabolites. It gives us information about their microbiome species, how not just what's present, but in what quantities. And then it also detects bacterial infection, yeast. It also looks at fungal presence as well as the parasites that we mentioned. It also gives us biomarkers for cancer, such as
I was going to ask you, does it have, but there's some cancers are detected through the biomarkers.
Correct. So it gives us those inflammatory biomarkers like calprotectin is there, and other ones that can tell us that, is there inflammatory bowel disease present, or potentially there H. pylori as well. So there's a whole
H. pylori is a big
so it's almost a 10-page
burning
results.
topic these days. H. pylori.
Yeah. And so in contrast to, let's say, a stool test that is done in a hospital setting, that's basically testing for a few bugs or lacto-ovoparasites, things like that. This is giving us a comprehensive bird's eye view of what does this patient's digestion really look like overall.
Right. So this is the whole idea, to give it a bird's eye view of what you have in your gut, and accordingly the treatment.
Correct.
Yeah.
And then in addition also, we do breath testing as well to see if somebody has what's called small intestinal bacterial overgrowth, which we can detect as well with a breath test.
Yeah.
And so that can give us some indication also of what's going on.
Yeah. So this is very interesting to know about the, the bird's eye view. Now, once you see H. pylori, and so far as the treatment is concerned, do you start the treatment, or do you send them to their primary care physician with all the information you have?
So in our practice, typically speaking, patients who do have H. pylori have typically already seen their primary care or their GI specialist and been treated. Now, if we do have to treat them, we can treat them for sure, or if we need to work with their gastroenterologists to make sure that, if they need a scope or something of that sort, then we're making sure that we're using every menu item available to treat them. If that makes sense. We do definitely help treat them.
So basically you look at their treatment, whether the maintenance dose is okay or not, because that's another thing, There might be in a large dose of particular with antibiotics, which might have another superimposed bacteria like Clostridium. So you check on those.
Oh yeah, we definitely do. We definitely do. Yeah.
And then depending upon that, then you do that.
Correct.
So can you tell us something about this holistic medicine?
Sure. So holistic medicine has been around for centuries, whether it's using yoga, Reiki, Tai Chi, Qigong, or using even practices like sound bowls and sound healing as well. We have known as human beings about these holistic modalities for a long time. Actually, I'm writing about this in my book as well that's coming out next year.
Right. You're telling about your book, and we are excited to see your book.
The book will be called The Wellness Bridge, coming out in 2026.
Okay.
So look out for it.
Not too much.
And so in terms of the holistic techniques, we have individuals in our office that are actually specialized in yoga and Reiki. So if they're interested in that, we can schedule an appointment with the person and have them see that. And also, as a trained osteopath myself, osteopathic medicine was founded by an MD, a medical doctor, Andrew Taylor Still, in the 1800s in the U.S., just after the Civil War. And the way he, and you can, the listeners can read his history and how he basically wanted there to be a better way of treating individuals. And he saw a relationship between our bones, our muscles, our skin, and our organs, and to say, okay, if there is a problem going on, could it be at the structural level? And could that also be impeding the flow of neural transmission or even blood flow?
Yeah.
And so again, this concept of flow that is there, of energy, of health, essentially, that's there, that even Dr. Still, the founder of osteopathic medicine, found. So in our practice, if patients are coming in and saying, I have a neck pain, I have this kind of issue, or I have that kind of issue, or I have TMJ, and there are other treatments we have available, but as an osteopath, I'm able to actually use my hands and feel around their head and neck, or feel on their chest, feel on their back, feel in their legs, and see, is there an area of tension that we can help to relieve and to work with their myofascia, the fascial planes around the muscle.
That's like a mind and body syndrome,
fibromyalgia,
where now they say that fibromyalgia is a mind and body syndrome.
Yeah, there are aspects to that.
They are all aspects of it. So now, having said all this, can you highlight our viewers about the probiotics in our food diet? So that is very important, for the people to know organic food and what they have probiotics.
Sure. So when you think about the concept of what is a probiotic, so probiotic is essentially a live and active culture of a particular microbial species. Like one of the popular ones, if somebody is having a yogurt, you might look on the back of a yogurt container and says it'll say live and active cultures. And usually you'll see families like lactobacillus or bifidobacter. Akkermansia is another one that's a big topic right now. These are all different probiotics, essentially. Now, when individuals go online, or they're on their Instagram, or they're in the stores, and they're looking at probiotics on the shelf, it can be very confusing. There's many different options. There's as many options as you can think of out there in that department. Now, for us, we like to focus on and saying what person is actually appropriate to use a probiotic for, because we don't think that everybody needs to be on a probiotic, number one. I don't take a probiotic every day myself. I
don't take it either.
But if there are times where I'm feeling a little bit low, or my immune system needs help, or I'm in need of a little bit of adjustment, I may use them myself. Now, there are certain ones that can be healing for balancing out the microbiome as well. There can be ones that also are needed if we're treating an infection and we have to re-inoculate the gut as well too, with certain colonies as well. So probiotics are a very individual conversation. What I like to tell people is actually to focus on prebiotic foods.
Prebiotics.
So prebiotics are the ones that actually have fiber in them. And fiber, when it's broken down by our microbiome, creates these molecules called short-chain fatty acids.
I read about that too, about the fatty acid. So it breaks the, prebiotics are more.
So when people are actually thinking about their diet, I would actually consider and you can even just simply Google this. We've even put posts on our Instagram on Grover Health about this. If you look at prebiotics and probiotics in terms of fermented foods like kimchi, sauerkraut, kombucha is another example.
Those are
yogurts, even if somebody is vegan, they can have a plant-based yogurt with live and active cultures in it. So things like that, pickled ginger, those are all going to be helpful to boost the microbiome naturally as well. And then the prebiotics also are there in any fiber food. So things like your oats, your grains, your berries, pomegranates, leafy greens, all those are fantastic.
So basically what it is, focus more on the prebiotics. And then, when I authored my book about the childhood development, and when I was doing the food chapter, what these kids should.
That's beautiful.
So
I love that.
I summarized everything about the prebiotics, probiotics, what they should be eating. Because, with the children's plate, they should have a well balanced,
And I think that's wonderful. And I think that's where
my plate.
The my plate method, I think if we all followed that, we would be healthier.
And then also I got this, this is more like like a healthy food, what everybody should be eating. This is
Yeah.
from another source. So basically, I did that for our family, parents, caretakers.
Yeah.
Said they know exactly what should be in the plate of their youngster. Of course, when they grow older, they know what they do.
Yeah.
So
Yeah. And I think,
healthy food.
yeah, as a parent, I understand that your kid wants a snack or a treat once in a while.
Right.
And that's okay to do, overall. But I think, as long as 80 to 90% of the time we're having whole foods, mostly plants,
Yeah.
and that are, more in their natural form. In the sense that if you, let's say, look at juice, a lot of times people might think juice is healthy, but really, you're just squeezing all the water out of the fruit, and you're just
Right.
leaving behind the fiber, which is actually the good stuff.
Yeah.
So you want to have both. That's why I like smoothies better, because you can actually put the whole fruit or vegetable in the
So
blender.
smoothie, you put everything.
Yeah, exactly. And that way you're getting the whole product.
Yeah.
The best is actually to chew, because when you're chewing, you actually get to digest the food better, and
Right.
you're actually, when you chew, you send a signal to your brain that you're getting more full. So
Right.
that's also important too.
Yeah. So it's very important to have everything chews and
Yeah.
how it does, how the signal goes to the brain when
Yeah.
you stop eating, right?
Yeah, exactly. Yeah.
So that is very good. I was very
Yeah.
happy. This happened my book got published about 2 years ago, but I still have this to show
Yeah.
how, about the children's, how the healthy food and their platter.
100% that's important for them to
Are very
understand. Yeah.
important, yeah. So now the bottom line is then the last minute tips, last 1 minute
Yeah.
tip for our viewers.
Sure.
What would you say the tips to optimize health?
So
during food?
I would say in brief that eat food that comes from plants, not
Plants.
that's made in a plant.
Plant-based, that is another
plant-based, yeah.
chapter,
Yeah.
Plant-based food,
So,
yes,
yeah,
yes.
So that's one part where then you're getting your fiber
Right.
and your antioxidants, number one. Number two, I would say that mindful eating, chewing your food 20 to 30 times as well, helps to digest it better so that it doesn't sit in your gut and cause more bloating. Okay.
But what do we do if somebody doesn't have, and somebody does not have the tooth? Then they blend them, right?
Then exactly, yeah. But for most of us that have teeth,
Right,
please use
you
them.
can chew.
Yeah,
that
exactly.
time. Okay.
And then I would say take a few breaths before you eat. By activating the vagus nerve, which will help
Yeah,
with
right, the
resting and
vagus nerve.
digesting,
Right.
just by even doing some belly breathing like a baby or a dog, where you kind of
Take a deep breath.
and a deep exhale too, because when you exhale, you activate the parasympathetic nervous system.
Yeah.
So if you just did those three things, and then buying organic when you can, going to farmers markets, and eating with people you enjoy eating with,
That is true.
that's
That is
also
true,
there.
Yeah.
So, keep it simple and
Yeah.
find out what works for you, is what I
Right.
would say.
And follow the
And then
recipe.
just rinse and repeat.
Right,
Because if you
yeah.
do that, then you're going to get to your goals.
Right.
Yeah.
So that I like to thank you sincerely for coming to my quiz show. You did a wonderful job even last time when you were here. And now more about this probiotics and the food stops. I like to thank our viewers for watching me on my health talk with guest speaker, Dr. Keshav Grover. And until I see you guys again, have a safe and a wonderful fall season. Thank you again.